Howdy Rockstars. One thing that we're all trying to do is make sure that when we try and help people that are in pain, we're doing the best job we can and providing them with the best of what we know with available evidence that will help them recover. So part of that is trying to make sure that we're not doing bullshit treatment that doesn't work for a long time because that benefits us as opposed to benefiting our patient. What we have to be careful of though, and I get it, trust me, like I've my whole career has been trying to do that, but what you have to be really careful of is that you don't go the other way for your own reasons as well. And what I mean is, you're not helping someone in the way that they want because you feel there is a better way to do it. Ultimately, the person who gets to decide is the person who's in pain. And a lot of our job, at least initially, is trying to help them make an informed decision around how best to get to where they want to get to. A super important point that I think we all forget is that you are only seeing the set of people who want help. There are a lot of people in pain right now today. There is a set of them who will ask for help. They will book an appointment with a health professional. What you don't get to see is the set of people who are out there in pain but don't want any help, whether they feel tougher or whatever the reason is that they don't need it or they understand it and they're quite happy to manage it themselves. For whatever reason, they're not asking for help. You are only ever seeing the people who want help by definition. They don't want Google, they don't want their Auntie Jan telling them about what they did. They want the help of a health professional. So you have to be very careful when someone is asking you for help, conditional on the fact that they want help, that you don't then treat them by just providing them with things that most of this is not scary, it's not broken, it will go away, this is all you need to do, stay active, all of those things. Just giving them the information that you understand to be true may not be enough. It might be enough, but you don't know until you ask the person. So presuming that a session or 2 sessions and some information and advice is enough for people who by definition are asking for help, I think is a mistake that clinicians make based on their own assumptions and their own identity and who they want to be. Just like, but in reverse, to the person who will see someone 60 times in 3 weeks because it's better for them. Really ask yourself if that amount of treatment is going to benefit the person who is asking you for help, or is it going to benefit you in making you feel like you're doing a better job and following the evidence? I understand where that comes from, and it is a good place. It's just making sure it doesn't manifest in a way that isn't actually helping. One thing I will tell you is that after all of this, I see these people down here, and I see the people that have been treated 60 times in 3 weeks and just feel like they've been ripped off. But I also see the people who've only been treated once or twice and just given some information, and neither of them are getting better. I have to remember too, I also don't see the people who go in and have a session and do get better, and they do exist. What I'm saying is that you don't know who they are just because they've walked in. And I would presume, conditional on the fact that they have booked an appointment, that they do want your help and your treatment and your advice. You are the expert around their problem, but it is their problem. So it is definitely a collaboration around how best do we get you what you want. You outline the options as best as the evidence tells us and your experience tells you, and it's then their choice as to which one suits them. But it has to be informed decision making. So they have to have all the information, not just your version of what you think is best for them. So remember that one. Everyone that you are seeing that is in your clinic with pain is in the set of people that wants help. How much help will change between people, but the only person who can decide that is the person in pain. Your job is to outline options and to help them as they want to be helped, not as you want to help them.